Hello and welcome to the channel. I'm Sarah and today's video is about hydrogen. What it is, what do people use it for, how do they use it, what does the research say? My guest today is Matteo Johnson, who's going to talk to you about the biology of hydrogen and different ways that you can use it. We don't discuss the physics of hydrogen assembly because David Schmidt touched on that when we were talking about the ether and plasma in our recent podcast. We also don't discuss the Planck golden ratio of the hydrogen bonds because Dan Winter will go over that along with lots of other things to do with physics when I upload his podcast. Your gut microbiome makes hydrogen if it's healthy, but the problem is with modern day living, a lot of people do have compromised guts. So I just wanted to mention this because there are always people who want to know what's the natural way to do something. But on the other hand, there are those who are interested in using molecular hydrogen as a therapy. My colleague Sarah Kleiner made a video very recently on a lot of the research behind hydrogen because it was very helpful for her daughter and my goddaughter, who's a non-verbal autistic, because hydrogen can be very helpful for lowering neuroinflammation in the brain. So if you want to check that out to learn more. Welcome to the channel, Matteo. Do you want to introduce yourself and tell everybody what you're going to be talking about today?
Sure. Well, first off, thank you so much for having me. I'm definitely honored and privileged to be on your podcast. And my name is Matteo Johnson. I'm the founder and the CEO of Axiom H2. We're a premium international molecular hydrogen company. We're using some of the most advanced technology in the molecular hydrogen industry. And so I'm happy to dive deep into, what is hydrogen, what isn't, what we've seen over the past 10 years with hydrogen, and who it can help.
I think people have heard about hydrogen, and there's quite a lot of hydrogen bottles now on the market, but it's much more than that. So maybe if you want to start by explaining to people what hydrogen is and how it's really important for energy and health in humans, but also there's a lot more to this as well, for pets and plants and things like that.
Yeah, absolutely. It's so versatile, the uses for molecular hydrogen. And so first off, there's a couple different forms of hydrogen. There's monohydrogen, there's dihydrogen, there's hydrogen peroxide, which most of us have heard of. And so there's different forms and they each have different characteristics. The specific form that we specialize in and we educate on and we use is called dihydrogen, also known as H2, also known as molecular hydrogen. And so this form has antioxidant-like properties. It itself is not actually an antioxidant, but it acts like an intelligent and a selective antioxidant. It's 100% natural and safe. There's not yet to be discovered a threshold or a limit, so you can't overdose on this. And this is why it's become a really big passion of mine because of its very high safety profile. And it actually has the highest safety profile of all medical gases. So that's one of the main things for my passion, is because it's so safe and it's so effective. Due to its molecular size, it is the smallest molecule in the universe. And given that molecular size, it can give us much higher absorption and bioavailability. Now, that's very, very important because we can have an incredible supplement, let's say vitamin C, that's an antioxidant, but it's very, very, very large when you compare it next to the H2 molecule. And that means vitamin C can only do so well as where it can go due to its size. Now, hydrogen, molecular hydrogen, can actually go into our cell walls, can positively affect our DNA, our nucleus inside the cells. It can actually pass our blood in the brain and its functions. So due to its high safety profile, its molecular size, giving it the highest bioavailability, and this selective antioxidant-like characteristics makes it just an incredible and valuable tool for humans of all ages, on medication, without medication. This is safe to take with other therapies and medications if you're on them. This is great for animals. A lot of the studies have been done with dogs and rats and other animals. This is very safe and very effective for animals, as well as agriculture as well. They've done a few studies with hydroponic systems side by side, showing regular water, how it affects the growth of the plants and the yields, versus hydrogen-rich water, which is basically hydrogen added to water. all water is H2O. H2 is a molecular hydrogen, O is oxygen. Now, when those two gases are combined, it creates this amazing form called water. And it has, all the solid state, the liquid, gas, it has all these different forms of water. But when we infuse and make what's called hydrogen-rich water, it doesn't alter the chemical structure of water. It's just adding available hydrogen to the water. Regular water, the hydrogen's not available because it's attached to oxygen. When we infuse it with hydrogen, it makes it available. And there's different forms and applications of creating hydrogen-rich water. Some are very stable. Some are highly unstable. Some alter the pH greatly. Some needs pressure. So there's a lot of different applications. We can dive into that later. But that's a little bit about what hydrogen is, why we need it, why it's safe, and why it's so effective. Acting like a selective antioxidant, it is selectively neutralizing certain harmful reactive oxygen species like hydroxyl radicals, the most harmful ones, and where it will leave other positive ROS and other positive like to not nitrous oxide. It's it's NO. Yeah, NO is another ROS that's a positive one. So we don't want to, take away every single ROS. We don't want to take away every oxidant because certain oxidants are used for signaling molecules. And so that's why it's just this very incredible and intelligent molecule that the scientists and doctors, they see what it does in the body. They just don't know how it's acting intelligently. In your body, Sara, it might create oxidants because that's what your body needs. And for me, it might create antioxidants because that's what I need. So it's very unique how it works in each individual, providing that individual with what they need and not what they don't need. So it's just an incredible molecule.
Just to recap what you went over, it's a very small molecule. It can get into the nucleus. It's very safe. It's natural. And there are many forms of it. And I think a big take-home message is for people that we could sort of say it's like an adaptogen, depending on what you need. And just because there's certain hydrogen species that do make radicals, free radicals are important for immune responses. They have roles in timing in the body. We could do a whole podcast on radicals, because I think people have heard of hydrogen, and you touched on this, that there's different ways in which we can administer it. So people have heard of inhalation, and they've heard of hydrogen-rich water, and they've heard of deuterium, and often ask what's the difference between hydrogen-rich water and deuterium-depleted water. So maybe if you want to elaborate now on the kinds of things which happen when an organism is given hydrogen, what benefits are there?
Sure. Well, yeah, you brought up some great points. Deuterium is another form of hydrogen called heavy hydrogen, and that is a harmful form, right? Deuterium is very harmful for us, and in all water on the planet has deuterium unless it gets removed through a very unique patented process. I think there's only 2-3 companies in the world that can properly make deuterium depleted water. It's basically extreme filtration process that is able to remove certain amounts of the deuterium out of the water, which is this heavy isotope of hydrogen that's harmful for us. And so deuterium depleted water is, coming up on the emerging into the health space to show benefits for human health. But what has more research is the hydrogen. And so when we apply hydrogen at therapeutic levels, in hydrogen-rich water or inhalation or a tablet form. They even have hydrogen-rich saline injections. We are administering hydrogen through goggles into the eyes, as well as hydrogen through the ears, direct route to the brain. So there's many different applications. There's even bags that we can different limbs with these bags filled with hydrogen, saturate the skin. And hydrogen-rich baths as well. It's very popular in Korea and Asia. But what people can expect when they start taking hydrogen is that it is not a stimulant, it's not a depressant. So some people might feel more energized, and that's what their body's lacking is energy. Some people might feel very relaxed and almost sleepy. That's because they're probably chronically fatigued. And so initially, people are going to have different reactions based on what their body is lacking, what they need. But in general, every single person is going to greatly benefit from hydrogen because it's going to, when it starts to neutralize these harmful reactive oxygen species, that is going to play this huge domino effect in the body to reduce inflammation, neuroinflammation, cellular inflammation. It's going to increase intracellular hydration, which is what we want. If we have excess extracellular hydration, that adds to more problems and inflammation. So we want intracellular hydration, which that increases. It also improves electron flow in our mitochondria, which in return helps us to produce more ATP production. And so there is just so many benefits that any person can get from this. So when we reduce inflammation in the body, that liberates energy. And so our bodies are bogged down and we're underneath par health because of too much inflammation. And extended periods of times of oxidative stress and inflammation presents this environment in our body to start to create and have the ability to manifest disease. But if we have the oxidative stress down and the inflammation down, our body is liberated from that and it allows our body to do its natural processes. And so, I mean, the root cause of all disease is excessive amounts and extended periods of times of oxidative stress at a cellular level. And so that's why we trademarked the term cellular optimizer, and that's the name of our machine, HW600 Cellular Optimizer, because that's what it's doing. It's optimizing cellular health. And we believe, in our opinion, when we repair the cells will repair the body. When you have a dysfunction in an organ, it's not, oh, this organ is just malfunctioning. Well, what makes up our organs? Our cells. Our cells run our tissues, our bones, our systems. And so we focus on the root cause, which is the cells, repair the cellular health, and then that will in turn start to repair the environment inside our body.
It's very important because it's almost like it's unlocking our own inner healer and it's taking away barriers for why we're unwell rather than doing something to the body. Because anybody who knows about supplements or lots of things, when you start using something, your body reacts, well, not reacts, you get resistant to it, or it stops working after a while because it's doing something and there's going to be down regulatory processes. Yes. Whereas with hydrogen, you're removing the thing that was causing the problem in the first place. Because people ask me all the time about how do I stop being dehydrated? And we all know in this sort of community that water drives a huge amount of our biology, along with light and magnetism and things like that. So this idea of being able to get more light or more water, just something so basic and simple as that's going to be very life-changing for people. Because I think we can't do anything about artificial light and non-native EMFs. They're everywhere. But if we have a tool which can offset some of the inflammation and also rehydrate at a cellular level, I think that's also one of the reasons why I've seen so many amazing stories from hydrogen. Because I was skeptical in the beginning. I understood how it works, but I think the key point is there's other things on the market which aren't the same as the machines which have had a long time to be designed. And also there is, I think, is there about 3,000 publications now on molecular hydrogen, and they're very specific in those papers exactly how the hydrogen was prepared and what parts per million it was. So do you want to maybe go into a little bit more about some things that you've seen with people? Because with an Axiom, people probably know already about my goddaughter, who is a non-verbal, and we've been through several different kinds of hydrogen machines. Because as people know from watching this channel, my entry-level machine was a HydroFix, and then I've moved into the Axiom. Not because there's anything wrong with the HydroFix, that my parents are going to have it and they'll be delighted with it because the Axiom wouldn't be what they needed. But I think what you've been saying about, first of all, delivering the gas through the ears and the nose, the inhalation, we've found that seems to be a big needle mover, as well as the fact that with the Axiom, it has a wand and you could make a hydrogen bath if you had the patience, or you could make enough for the whole family. So do you want to maybe talk a little bit about things that you've seen and the protocols that people use to get there, because there are some people who drink hydrogen water and that's it, they just do that, and there are others who go and use other sort of forms of hydrogen administration.
Yeah. Yeah. Thank you for sharing all that, Sarah. And yeah, we've seen a lot. I've been in this space for close to 12 years now, where I first discovered it and started using it. And we launched a company 3 years ago in 2022. And so what we've seen has just been remarkable. I'll share some anecdotal evidence as well as some of the different doctors we speak with on a monthly basis about what they see in their clinics as well. One very exciting um, confirmation that I just had yesterday with chatting with the doctor Nasha Winters,
Oh
and
yes, I know.
she,
Mm,
yeah,
yeah.
yeah, it's amazing person and great research, incredible research, and I highly encourage you guys to check out some of her research. But what she had shared with me yesterday, and I hope this is okay to share, but she said the one thing out of all the drugs and therapies and treatments she's been experimenting with for spike proteins, she said the one that works is molecular hydrogen. She said, and it's the only thing she's ever found to actually break down these spike proteins. And in her practice, without those spike proteins broken down, it's almost impossible to get any progress done on the rest of the body. So she found that that is this key element of molecular hydrogen breaking down these spike proteins. So that's big information for a lot of us that are curious about that for themselves or loved ones. Um, there is a lot of studies done showing protection against radiation and chemotherapy. And we had a gentleman here in Costa Rica. He had, I believe, had cancer. I don't think he has it anymore. Had cancer. We got him our hydrogen machine, the home model, the HW300, which is 300 cc's per minute. I said, try to use this about 5 days a week, minimum 1 to 2 hours a day. And I gave him our prototype of our hydrogen-rich water bottle that's creating super saturated hydrogen-rich water. And so I said, if you can, drink 1 to 2 dosages of the super saturated hydrogen-rich water, which is over 9 ppm of hydrogen-rich water, and then the inhalation. And so they said they were using it. Himself and his wife started using it. He had 24 sessions of radiation done. And out of all the 24, only one session did he actually feel nauseous. And he said that's just unheard of. The doctor couldn't believe it. The gentleman, since he had cancer and radiation therapy, he said the best he ever felt his whole life was during the radiation therapy when he was using the hydrogen. So he felt better with hydrogen and radiation than before radiation and before hydrogen. So that was just incredible to hear that it really didn't negatively affect the radiation, but it did subdue those negative side effects from that radiation poisoning of what it really is. Also, we have our clinic, our head medical director, Dr. Alan Inman, has seen multiple cases, 1 in 4 sessions of hydrogen inhalation. This is at 600 cc's per minute, combined with megadose glutathione via IV. He saw a reduction at 30% in a cancerous tumor, and that's in four sessions. He had another patient that I believe after 2 months of the hydrogen, the cancer is now in full remission. We had a Parkinson's. I think it was Parkinson's. No, I'm sorry. This was Alzheimer's. Alzheimer's, an elderly woman with Alzheimer's, basically not really coherent to her environment. She was just kind of there, head down. She used the machine for 30 minutes and she walked out the room full of life, speaking as if she was a complete different person. We've had cases of just our tablets alone, which we have a very unique solid state hydrogen tablet, of putting lupus in remission after 4 months on the tablets. And that person wrote us, giving us credit towards the tablets that was able to get them there. And And, you know, I want to be very transparent. I don't want to say that hydrogen is this strong, but what I've seen and what I can conclude is that, as we spoke about before, when we remove the barriers and the obstacles, we liberate energy and we increase our mitochondrial productivity, the body does what it's naturally designed to do, which is heal, right? And so if you have more energy, you're probably going to have more motivation. If you have less inflammation, you have less pain. You might have a little bit more oomph to get out of bed and go on that walk. And right, so one thing trickles to another, trickles to another. Now you're walking, now you're getting sun, now you're getting fresh air, you're moving your body, you have motivation, you don't have pain, you're feeling happier because it helps with our serotonin and our hormones. You're having better digestion. And so this little key factor of hydrogen was the precursor and the domino effect to create all these other processes. Now you're motivated, you're going to the gym, you're doing X, Y, and Z. So I don't want to say that hydrogen is curing cancer or curing lupus, but it is that special trigger that started this domino effect of all these other positive things that are going to help towards achieving a healthy lifestyle. We've also seen numerous cases in autism. We have video testimonials of this, from going from nonverbal autistic children to verbal, where they couldn't actually pass grades. Now they're passing the grades. They're sleeping through the whole night now. Before they couldn't sleep through the night. Violent outburst hasn't happened in a year's time. So we're seeing great improvements with autism. And a lot of that, I believe, happens to do with, you know, neurological irregulation, dysfunction, and dysfunction in the mitochondria. Let me see what else. I mean, there's so much amazing stuff. Obviously, we're with the NFL, the NBA, we're with UFC, we're with UFC fighters, pro boxers. So the athletes, this is like a no-brainer. For athletes, this is WADA safe, WADA compliant. This is not illegal. It's not part of the anti-doping, anything like that. And we're seeing a huge increase in cardio, performance, recovery, hydration, and overall performance. So that's like an easy one. And then erectile dysfunction, we've gotten feedback from an improvement of erectile dysfunction, improvement of digestion. We have people, sometimes they send us their blood work, that they had their blood labs done on reactive protein, was very high at 19.4. And after, I think, a month or two on the hydrogen, breathing, this is the Axiom machine. And then he was actually doing rectal insufflations with the hydrogen as well. He said the doctor couldn't believe it. He couldn't believe it. Went from a 19 and change reactive protein after, it might have been less than 2 months. And then now it was at like a 0.79. Just unreal changes there. And then let me see what else we've seen. Dementia, we have a video testimonial, stage 4 dementia, 100% non-reactive, non-responsive to her environment, 88-year-old woman. After 7 days on the Axiom machine, the HW600, she was full responsive, had full cognition, was feeding herself, petting the dog, asking her son, what are you thinking about? Where are we going? Before that, totally checked out. I mean, we have mitochondrial diseases immediately improving from the first session. We have rosacea going away, a few cases of rosacea going away, psoriasis going away, inflammatory attacks from a woman that traveled to Africa. And she gave us a video testimonial. She came back. She didn't know if it was a parasite or what it was, but the inflammation would come on her neck and her wrists, her legs. So bad. She tried everything. Nothing worked. The hydrogen machine, she's like, is a miracle, is the only thing that stopped those inflammatory attacks from occurring. Wow. And there's more too. We have a detached retina case. This gentleman, he put on our goggles and it actually improves his detached retina. So he's now holding off from getting surgery. It's the only thing he was told he could do for detached retina was get surgery. And he tried the eye goggles and they're starting to improve that. Eye twitch, people with that eye twitch that won't go away. We've heard numerous cases. One session of the eye goggles, eye twitch is gone. And I mean, yeah, there's a lot. We have a COPD, a lady, an elderly woman, I believe she was in her mid-80s, had COPD. She was using the machine about 2 hours a day, breathing the HW600, went through about 14 days of heavy detoxification of mucus out of her lungs. So much mucus was coming out every day for 14 days, she went to the ER. Emergency room said, hey, you're actually surprisingly, despite what you're going through, all your numbers look very, very good. It's kind of strange. They said, we don't know what's going on. Maybe you have walking pneumonia, not sure, but you definitely don't need to be in the ER. 2-3 weeks after the ER, she sends us another email and says, hey, I went back, everything's fine, the mucus is gone, and I no longer have COPD. So, I mean, and now we're at a point, we've never put dollars in marketing or advertisement. All of the revenue and the profit generated has gone back into research and development, perfecting our technology, perfecting our service, perfecting the production of quality control, and new clinical trials. So we're now starting clinical trials. We're partnering with different laboratories in the US, and we have a new research and development firm out of Europe that works with the European Space Union. So we now have just slowly developed this incredible team to continue to perfect our results, and we're results driven. And so to tie up this long-winded response, part of the protocols that we recommend is everyone is a little bit different, right? And we've seen people, hydrogen water, I don't really feel anything. Hydrogen inhalation, they're different. They're changed immediately, right? And vice versa. We've seen people, hydrogen inhalation, I don't really feel anything, notice anything. They do the hydrogen water, that one works really well for them. Now, every form of administration for hydrogen via tablet, saline injection, inhalation, and or hydrogen-rich water or hydrogen-rich bath will make it to all your cells in the entire body with about 10 to 15 minutes. But what we've seen is that where the hydrogen gas touches has a much faster response. So if you were to have to choose inhalation or hydrogen-rich water, and you have a gut health issue, I would say go with the hydrogen-rich water, because that way the hydrogen's actually touching the gut and your the lining and affecting that bacteria. Now, if you have an issue with your heart and you have to choose water or the inhalation, we're going to say the inhalation because we know that affects the heart greater. So inhalation is typically cells, muscle tissues, heart, and brain. Water is normally the organs, liver, your internal organs is really what the water's best for. And then, neurological issues, we're going to say the earphones because direct route to the brain. Obviously the eye issue is going to be the eyes and things like that. So that's what we say as far as our protocols, if you have to choose one or the other. But with the Axiom, when you purchase one of our devices, you can make hydrogen-rich water, you could do inhalation, you could do the earphones, you could do the eye goggles, and we include all of our tablets too. And what we call the triple punch is a tablet daily. This is not a water-dissolved tablet that you drop in water, there's a chemical reaction. This is actually a solid-state form where we use a very specific patented technology called dry water. And this form of dry water actually captures gas into liquid microclusters that look like powder. And this powder is actually microclusters of liquid that contains the gas. And so that is our solid state form of hydrogen. And so you take a tablet a day, you do not dissolve it in water, you take it orally, you swallow it down, and through the heat in our stomach, it starts to release the hydrogen. You take one of those on an empty stomach daily, you substitute all your regular drinking water with hydrogen-rich water, and you do at least one 1-hour session minimum 5 days a week for 30 days. This is our universal protocol, the triple punch, and we've never not had astounding success. And I encourage anyone with any condition, perfect health, you want to be an athlete with better health, you're in stage 4 dire condition, whatever it may be, we encourage anyone to try that protocol. And especially if you have data points to validate certain markers, if it's HRV, if it's resting heart rate, if it's respiratory rate, if it's lung capacity, if it's our VO2 max, if it's mitochondrial health, if it's cellular health via live dark field microscope, If you're checking different blood panels, even hormone panels, there is research showing that it actually helps to optimize our hormones and improve testosterone levels with men with low testosterone. And so I never want to say this is a test booster, like it's not going to give me extra testosterone versus what my body's naturally designed to have. And so we've seen it help with pregnancy and women going through hormonal imbalances with menopause as well. It seems to affect almost everyone in some form or another because it's repairing our cells and the cells run our body.
We each have our own Achilles heel for whatever reasons, and that's why we have all of these different so-called conditions or diseases. And as you've described, it's not, you're not trying to say it cures things, it takes away barriers to healing. And I think I'll add to this, whenever sports people are interested in something, because they just want to be 1% better, because that's the difference between being first or last. And if they're invested in something, they're in. And also with things, if somebody doesn't like something, they don't buy it. So I want to go into like the placebo effect, because there's lots of different ways to make hydrogen using these little bottles. Do you want to talk a bit about the actual science of a little bottle with a battery in it, and the science of a large machine that you plug in the wall, and what's the difference and why does it matter?
I want to thank my sponsor, Lightwater Scientific, who helped me deliver free valuable information to you and also allow me to have great guests on this channel. Lightwater Scientific produce the purest and most deuterium-depleted water in the world. Depleting or lowering your deuterium has numerous health benefits, from better metabolic health, more energy, greater resilience, less brain fog, increased physical performance, enhanced healing, and healthier mitochondria. Deuterium is an isotope of hydrogen, also known as heavy water, because it's bigger and heavier than regular hydrogen. Even though deuterium makes up only 0.02% of hydrogen, it's found everywhere. Deuterium is a burden to your body because it interferes with the intricate chemical reactions that occur by slowing them down. Deuterium is kryptonite to your mitochondria, and we need healthy mitochondria to produce energy. There's over 60 years of scientific research on the negative effects of too much deuterium on health, and also the positive benefits of lowering deuterium in the body. Lightwater deuterium-depleted water is 100% safe and non-toxic. In fact, it's the closest in structure to the metabolic water that your mitochondria produce. Lightwater deuterium-depleted water comes in 5 or 10 parts per million glass or plastic bottles, so level up your health by leveling down your deuterium today. The purchase link is in the show notes, and use code DRSARA for a discount off your order.
Sure. Yeah. But, as you said, placebo effect, it's a very real thing. I love that study. It's so fascinating how powerful our mind is. And, but now after 10 years, I can tell you, in my personal opinion, 110,000% not placebo, at least with my products. And we've had our products compared by other machines and other bottles too, and tablets. And so it keeps coming back as this unanimous decision to say, hey, you know what? I tried these other tablets, didn't feel it. I tried your tablets, I felt it. We had a lady, she worked with David Asprey's team for many years. And I had a phone call with her the other day, and she goes, one thing? She goes, I've tried every other hydrogen machine on the market. And she had this foot injury for a few years. She said within 10 minutes of using your machine, immediately her foot pain went away. She goes, I've used all the other machines out there. Higher flow rates, this, oxygen, Brown's gas, all the things. She goes, nothing changed my foot. Within 10 minutes, I knew immediately that it had immediately reduced that inflammation in her foot and the pain went away. And so the product does matter. Just like, you could say, vitamin C is bad. Well, what company did you get it from? Example. So quality does matter, and it will affect the results. So back to your question with the bottles and the different processes. And these bottles, by the way, they're not brand new. They've been out for probably 15 years. They've been out for a long time. But I never got into that. I never wanted to sell those because the technology wasn't really available to make a proper bottle that could move the needle. And the ones out there from before, I had a friend that ran a clinic. He bought 100 bottles thinking he's going to sell these things like crazy. I said, beautiful bottle. Have you tested it? He goes, yeah, it's got hydrogen. I go, there's a lot more you guys need to test than just hydrogen coming from the bottle. Because there are different forms. Most forms of the bottles are using what's called ionization. When you ionize things, you're changing the pH of the water. And so you're alkalinizing the water. And when you do that, it creates hydrogen as a byproduct. So you get very high pH of your water and you get some hydrogen in a very unstable form. And when we have an acidic stomach, it typically stays around 2 on the pH scale, which is hydrochloric acid, a very, very highly acidic acid. Even more acidic than a lot of carnivore meat eaters is the human stomach. It's very acidic. And so drinking high amounts of alkaline water for daily drinking for long periods of time is not going to be good. There's lots of research to back that up. And that's my first thing when I see a new bottle or hydrogen-rich water product is check the pH of the water. I personally don't want to be drinking a 10 on the pH scale. Don't want to do that. It's going to give me issues. What I do want is to have more of a neutral pH and high amounts of hydrogen. Now, through Molecular Hydrogen Institute, they have reported that the minimum reported therapeutic effect of molecular hydrogen in water to positively affect humans is 0.5 ppm per liter of water. Now, most people aren't going to drink a liter of water in a sitting, right? That's a lot of water to drink. So you're going to want a lot higher than 0.5 ppm, so you don't have to drink a liter to reach that therapeutic amount. So I can't do the exact math because that's not my strength, but what I can say is you're going to want something well over 2-3 ppm, so that way you could drink a few ounces of water and get that minimum therapeutic effect. Not that we want the minimum, because in general, the higher amounts show much greater results. But back to the science behind the ionization. And so I believe that the ionizers, water ionizers, they claim a lot of things with hydrogen. I know they use the alkaline water for cleaning their face and the acidic water for cleaning dishes. There's a lot of things like that, but I don't want to get that mixed up with hydrogen-rich water. And there's definitely what I call dirty hydrogen and clean hydrogen. Ionizers, in my opinion, is dirty hydrogen because it's not the hydrogen I want to be drinking. It's not all created equally, not all the same. And I don't recommend, neither does Molecular Hydrogen Institute recommend drinking high amounts of alkaline water, even with hydrogen. And so one thing we want to test besides the pH, besides the ppm, is the ORP level, which stands ORP, stands for oxidation reduction potential. This is one factor of many to give us a little insight of the quality of the water. Now, to give everyone a point of reference, a positive ORP level, we're going to say plus 500, is something has the oxidation profile of like Coca-Cola, right? Soda, very acidic and highly oxidizing. Or positive ORP would mean it has a high potential of oxidation properties. When we get down to neutral, it's neither, which is 0, it's neither oxidizing or anti-oxidizing. When we get into negative, it's going to have antioxidant-like properties to the water. So in general, we definitely do want to see a negative ORP level with things that we are drinking and consuming. Coca-Cola having a positive 500. Let's say regular, clean, filtered drinking water has typically a positive 200 to 250. Distilled water is typically around 0. And you start getting to negative, or the negative realm, when you get into antioxidant. Things like green tea has antioxidants in there. So you're going to have a negative 100, maybe 200 on the ORP scale. You get into a proper hydrogen, like for my technology that does over 9 ppm, we see like negative 800, negative 1,000. That is the antioxidant-like properties of this water. So another thing I have to state, because it is a bit of a long-winded response, is that to accurately measure the parts per million in the water, there's really only one way to accurately do that, and that's through gas chromatography. It's a very, very expensive technology, typically around $100,000 in a laboratory. And for us as people that don't own laboratories, and maybe you do, I don't want to speak on your behalf, but for the average person, it's going to be around $650 and up from there to just get this test done to get accurate levels of hydrogen in the water. So everyone needs to be aware of that, you know, digital meters, like we offer digital meters with our machine. It's included with our machine to validate it, but it's not for precision and accuracy. It's to give some insights of properties of water changing. There wasn't hydrogen before, and now there's hydrogen. To accurately measure that, it has to be done through gas chromatography. But through ORP, that helps to give us a little bit more data, the ORP levels measured in millivolts, and through pH, that helps to give us a little data. And in a rough estimate of the hydrogen through digital meter or a chemical reaction through H2 blue drops can give us a slightly more accurate reading of available hydrogen in water over a digital meter. So all these different factors go into what us as consumers need to be aware of, so we're not just buying something and wasting our money or buying something and hurting ourselves. And so one thing that, and this is why I created my own hydrogen company, by the way, the whole reason Axiom was ever started was because I started seeing what was going on in the alkaline water industry, the hydrogen water industry, the hydrogen generator industry. And so I realized that, hey, I need to go reach out to all these companies. I need to find out the pH, the ORP, in a gas chromatography test. And I realized that almost every company couldn't provide that. And so I said, whoa, this is a big red flag. Why can't they do that? These meters are, some of the meters are $30. Like you can't show me an ORP reading on your test. You can't show me H2 blue drops. You don't have gas chromatography tests. You know, these things started becoming pretty prevalent. Not being able to get anyone on a phone call. This was kind of like these red flags started showing up here, here, and here. I said, look, I'm done with it. I need to create my own company, my own product with transparency, with proper customer service, and with proper testing. The people that understand hydrogen need to be creating hydrogen, not just trying to capture the market share. And so what I realized in industry, these water bottles are highly alkaline, sometimes 9.5 or even up to 11, with some hydrogen in the water. With further testing, we found out some of them had lead, some of them had harmful heavy metals in the water. Some of the bottles created hydrogen for 3 months. After 3 months, they started making less and less hydrogen. Some never made the hydrogen to begin with. Some made it, but it was highly alkaline. Some made it highly alkaline with harmful heavy metals. Some made it, but it was underneath therapeutic levels. So yeah, you had 1 ppm of hydrogen, but your bottle only had 8 ounces of water, right? And it's 0.5 ppm per liter of water for minimum therapeutic levels. And no one should be chasing minimum therapeutic levels. We should be meeting the minimum therapeutic and then way exceeding it, right? And so the clinical studies show that under 6 ppm, there is very, very little bit of beneficial effects of hydrogen-rich water with rheumatoid arthritis. But when you get 6 ppm and above, rheumatoid arthritis almost completely goes away. And it's just phenomenal. So all these things matter. And so understanding what is the therapeutic levels of ppm in water and how much water you need to consume. I mean, if not, you're just treading water. You bought a bottle, you drank 3 of the glasses a day, and they were all under therapeutic levels. And they were separated, so your body and your blood never reached the saturation level to hit your therapeutic effects in your blood. So, I mean, none of this is taught. No one's taught any of this. The companies pop up, they offer you a product, and one hydrogen water bottle company will make the claim that their hydrogen water bottle can basically match the 3,000 beneficial studies of hydrogen, when 35 to 40% of them are done on inhalation. So you're selling a hydrogen water bottle and you're trying to match it with the inhalation studies and or the studies done on water, but the ones done on water had 8 ppm. or 5 ppm, and your bottle is doing 2 ppm, and there's only 8 ounces of 2 ppm. So there's so much lacking information in industry that I got frustrated, and I made it my own responsibility to keep shouting out hydrogen on a mountaintop, but giving you guys a full story. And that's also why when someone purchases our mid-range model, the HW600, we include a level 1 accredited certification course through Molecular Hydrogen Institute. Everyone that works for our company, we have a very small core team, about 6, 7 of us. We're all certified at MHI. We include that for free with the purchase, and we're not affiliated with this institute, but we are passionate about education and transparency. So that's why there's not a lot of products that you buy an ozone machine and it comes with a meter to measure the ozone that it's really making it. And then there's an educational course to learn how to use the ozone. Companies aren't doing that. And I wanted to do it different. I wanted to provide you guys with what I wanted all the years I was spending thousands and thousands of dollars with other companies and not getting results, not getting the support, not getting the help. And so that's where Axiom H2 is. And now we have a water bottle that's using a proton exchange membrane, all medical grade components. And versus proton exchange membrane, when we go back to the technology of different forms of ionization, electrolysis, and proton exchange membrane, is that is the most current utilized new technology for electrolysis. Electrolysis is just separating molecules, H2 from O, things like that. Most systems on the market do not separate the H2 from the O, and they go this way. They separate them, and they go back together. So now your water is going to have oxygen separated but back infused, and oxygen has, I believe it's hydroxide ions, which are alkalinizing and also somewhat harmful. So we don't want any oxidation. We don't want oxygen or anything oxidative. We want antioxidation. And that's why our technology separates the oxygen. We don't use it, and we just capture the hydrogen, which is the antioxidant. And hydrogen alone will not alter the pH of the water. We don't need to be messing with the pH. We need to be making available high levels of hydrogen in the water. And so that's what our technology does. And it uses a very highly pressurized system that, again, we haven't publicly released the exact ppm yet, but I can tell you it's well above 9 ppm. And this is just unheard of in the whole world. And so Axiom H2, we had developed that. And so now the very sickest of the sickly people that can only drink a few ounces of water in a situation of dialysis, and they're so sick, they could drink our super saturated hydrogen-rich water, and they're getting that intracellular hydration. It's like them drinking a liter of water in just a few ounces. That's how hydrating a super saturated levels of hydrogen-rich water is. And so those of you on the market looking at bottles, you want to reach out to the company and see, can they provide you with the ppm levels from accurate testing? Can they provide you with a report showing that it's clean water, there's no harmful oxidants or harmful off gases like chlorine or ozone? And another thing too, because we're diving deep into this, is those tests that they did for this quality assurance of the gas production or the gas purity, was that done with a brand new machine? Right? Why not test it after 1,000 hours or 500 hours? Because maybe it starts to break down, create less hydrogen, and release harmful things. It's like, you're going to run this car test, and you run the test on the car, and it's brand new. Of course it's going to run great. Even the worst car companies, a brand new car is going to run great. But the real proof in the pudding, the real substance comes from when the car is broken down, it has some miles on it. When the machine is actually used 6 months into it, you're at 500 hours, you're at 1,000 hours, you're at 2,000 hours. That's what we really need to find out is my machine producing clean gas, sufficient amounts of gas, and or hydrogen in the water after 1,000 hours? This is what no one in the whole industry is talking about.
Well, absolutely, because I've got your device, and my friend and I, we are nerds, so definitely we can agree that some of the bottles do make it to almost like 2.5 or even 3 ppm. But then, if you just do it every single day after 3 weeks, it's only 1.5. And then sometimes they'll make water, and you'll measure it, and then in half an hour you come back and
It's gone.
half the hydrogen's gone. Whereas with the Axiom, we've like tried to prove it wrong, and even with their bags and things, or if we've made hydrogen water and we've put it somewhere and come back in a week and it's still got the same in it. So there's it is correct what you're saying, but also with the bottles, it's sometimes just common sense. If it's one person who's done all of his research versus a company that just wants to mass produce something because it's trendy. And
Yep.
being a scientist myself, I look at sales pages because people send me sales pages every day, and I know full well they're just using all of the medical studies for the water bottles. It's not a study on that water bottle. They're just saying hydrogen does this. And when you read the medical studies, as I talked about right at the beginning, they're very specific on which machines
Yes.
they use, and it's all controlled, and the ppm is very important. And I think just for people who are listening that don't really like numbers, 2 ppm's good, but something like 6 or 9 is outstanding. So, and in terms of things I've measured, I've not found something to be 6 or 9. But then you were saying you've got a new bottle coming out at some point that's 9 ppm, and then
Over.
over. Okay, yeah, exactly. And it's something that people can, if people don't, because I don't believe anybody about anything until I've tested it. So that's why we have
Hmm.
your measurer. And then just so people know, we have met each other before and we had a really good chat about hydrogen. It went very, very deep, but I still didn't buy an Axiom, and because I just needed to like find out for myself. And then, as people just heard at the beginning, my parents are getting my HydroFix because I'm replacing mine with your machine. Because I think another important thing about the hydrogen bottles is it's not doing the triple punch, because people just use the bottle. They don't use
Yes.
hydrogen tablets as well. And you can't, some of
Right.
the bottles say you can do inhalation, but it doesn't have the power to push the gas out.
Right.
So, but then of course there are always people who swear blind. I bought a hydrogen bottle and I feel better, and I'm like, well, great, I believe you. That's fine, but you know, maybe it's the placebo effect. Goodness knows, you know, I'm not even going to go there. I just say that's great, I believe you, but it might not work on someone
Hmm.
really sick. And
Right.
I think another question that comes up all the time and is about the different technology behind the tablets, because I think it's magnesium malate that's the general tablet with the original one that they're blue when you drop them into water, and you can put 20 in if you want, and the water heats up. And they're all very good and useful, and as long as you don't use them for too long. But what I know about those tablets is, if I think one manufacturer makes them, and then they're white labeled. So
Yep.
it's the one recipe, and then
Yep.
what you've brought out now is a whole different way of making a hydrogen tablet. So do you want to maybe talk, just to finish off, about the differences between the hydrogen tablets and why it's helpful, other than it's just really convenient just to take a tablet, not to have to look for water to dissolve the tablet in?
Hmm. Yeah. The tablets are, like you said, extremely convenient. And that's where I started, 12 years ago, was with tablets. And when I heard about hydrogen from Japan, from a scientist, and I said, oh, this is interesting. And I tried a hydrogen water, and then I started buying the tablets. And then after a while, like you said, instinctually, my body just stopped resonating. Said, no, I need to stop buying these and taking these every day. It wasn't a forever fix. It was like a temporary thing. You travel, you can use the tablets. It definitely did the job. But at some point, I said, I'm not going to offer this. Axiom will only offer what we know for our fact on our own research team and in our own lab tests and everything we've done. We're only offer, because it comes back on a reputation, what will absolutely move that meter, and that people are going to say, wow, this is a great product. That's what we want to be talked about Axiom. And that's why we didn't rush to the market with tablets. We didn't rush to the market with bottles and machines, because we weren't in a rush to make money. We were hyper focused on creating the best product. And so this form of dry water, I actually don't talk about this much because I've been, we know where our competition, the other people out there are hyper focused on Axiom. What is Axiom doing? What's on their website? What accessories do they have? We have people with other companies, with other machines coming to us to get our course at MHI, to get our meter, to get our accessories, to talk to us on the phone that are educated and they need help with protocols. And I said, what, by the way, what machine do you have? Oh, well, I can't speak on that because we don't have that machine. We don't use that type of flow rate in X, Y, and Z. But the tablets are so powerful, and it's just not even funny how powerful they are. And people say, well, if the tablets work so well, why do we need a machine? You don't. Again, I'm not trying to sell you guys anything. I'm trying to educate, and we're here. We have a product and a service. If you want to use it, great. You're buying other tablets, great. I recommend when you're done that bottle, try ours. And so to reveal most of the technology about the tablets, with maybe not everything, is that, again, there is a form called dry water where it puts liquid into microclusters. And these microclusters will still hold the gas that was in the water. So what we do is we make hydrogen-rich water in a very, very stable form. And then we put the liquid of the hydrogen-rich water into the microclusters, also this process called dry water. And then they get compressed into these, it's like a nano honeycomb machine that compresses it in a tablet. And then each tablet is individually wrapped and sealed. And so, as you stated, every single hydrogen tablet on the market is the exact same. Not one person has it better or worse than the other. They're all made from the same person. We all know who they are. They white label for everyone. And Symbiotic has it, and Dr. Mercola has it, and now Gary Brecka, his son, just launched their own hydrogen tablet, and it's all the exact same. And I've never thought that that was a big meter mover. In my experience, in our anecdotal evidence, in our laboratories, with our patients in clinics, we've never seen those tablets move the meter. Our tablets are absolutely having crazy powerful changes, and so we're not using that same form of magnesium. You can tell our ingredients are completely different, and we specifically say, do not drop this in water. This is the only tablet, hydrogen tablet on the market that you can consume orally, and it's not going to harm yourself. 100% natural ingredients, no harmful binders. We don't have titanium dioxide for no reason in our tablets like majority of companies do. And so once this honeycomb compressed tablet gets in contact with heat in our stomach, it breaks down and releases high amounts of hydrogen. And so our tablets are third-party tested. They couldn't understand how it was making hydrogen in the water because we don't reveal a lot of times about the dry water process or the honeycomb form to hold the hydrogen. And so it is extremely unique. Far as I know, we're the only ones that have it. We do have exclusivity in North America, and it's made by a biotechnology company, and they do pharmaceutical and different biotech supplementation. And so it's just a very powerful tablet. If you guys are taking hydrogen tablets, good for you guys. You're on the right track. Give Axiom H2 tablet a try, maybe on your next round of tablets, and just see. And a lot of times for children that they can't sit there, you drop the tablet in the water, you need to wait 3 to 5 minutes for it to break down. No one's going to sit there and wait, because if you miss your window right when the tablet's done, then all the hydrogen is off gassing and you're kind of missing your window to reach those therapeutic amounts. Even my brother's girlfriend, she was buying the tablets from Dr. Mercola or Quicksilver. And she goes, yeah, on the plane, I take those tablets, but I need to get a cup of water. It's shaking, it's rocking around, and I need to wait. And I need to get water, I need to get a cup. And she goes, yeah, but with your tablets, I just pop it in, take one little sip of anything, sip, and it's down and it's gone. You don't need to wait 3 to 5 minutes. You take it, keep it moving. And so they're very unique, and we love those tablets, and so much that we now include them with all of our products. You buy a bottle, you buy a machine, you buy anything from us, we give you a bottle of tablets because we just want you guys to try them. And And if you have the tablets, they're great for travel. Or like me, I'm always on the go that I can just pop a tablet in the morning or right before bed at night. I'll take one right before sleep. And they're very, very powerful and we highly recommend them. And we are actually going through a clinical trial with those tablets as well. So as we speak, every single one of our products in our company is getting clinical trials done. And so hopefully before the end of this year, we will have clinical studies done on each one of our products to share with everyone.
Oh, that's really interesting because when you were talking about the children and the tablets, I was thinking of my mum. She'll drop them in and just wander off, and then, or she'll complain, "Oh, it's frothing." And actually, on the subject of my mum, I've just bought her a lot of. I bought her a HTMA and some extensive labs, and then a urine test, and it does. She did. She said she wasn't feeling very well. It did turn out to be a UTI, but she is 81, and so
Right.
she'll happily. She loves taking supplements. I'm not sure how she'll view inhaling hydrogen, but she'll be a really good guinea pig to try the Axiom tablets on because she'll be getting some water as well. But whether she'll make the water how I want, I've got no idea. I mean, it took ages to train them to distill water, but I think she's now a perfect example of testing the tablets because if I explained to her what they were, she'd be really excited because it's just another supplement. And exactly for convenience, the window for drinking the frothy water is quite small. So that'll be something I'll be able to report back to you as well. And yeah, I completely agree with you about not taking them all the time, that they can be really helpful for travel or whatever. So it's definitely a work in progress. In terms of any new products, I mean, I know your range. Is there anything else that's you're working on that's going to be out in 2 years, or is this it for your set of hydrogen tools?
Well, we, as I briefly stated, we've recently partnered with a company that's, a research and development firm working with the European Space Union, and they're just the most brilliant team of scientists and doctors and PhDs, and I just love every single one of our calls with these guys. So they are improving our existing technology and they are developing our new provisional patent that we've applied for and got approved for. So it's now our products are patent pending, and I can't share everything about the patent just yet, but it is not only going to be revolutionary to the hydrogen industry, but it's going to be revolutionary to the scientific community in the world. It's a new discovery of what we've done with the hydrogen molecule, and it's very, very exciting. So we actually don't even grasp the depths of the future with this new patent getting perfected right now, but we are already in communication with companies working with the DoD, Department of Defense, and military and government contracts. So there's lots of things of that coming up to help rapidly heal the body in a safe fashion. And then we're already working on an agricultural project. So we're now offering custom-made machines for different size agriculture applications. So mega grow houses for the medical marijuana industry, or organic farming, organic permaculture. We're getting different units built out for different size applications for the agriculture industry. And then, believe it or not, we have technology already being used and prototyped in the field for automotive industry with hydrogen and automotive world that you might have heard of. Hydrogen engines are already out through Toyota, Hyundai, Porsche, and many more. But what we've done is created kind of like a power cell unit that can be added onto your existing engine. May it be a diesel or regular gasoline. And it is improving gas fuel efficiency by close to 40% and power around 20 to 25%. And it's also cleaning carbon deposits in the engine too. So what hydrogen does on the engines, cleanses it, it runs more efficient, stronger, and increases the life expectancy, just like it does for humans, right? It's cleansing our internal components, our carbon deposits. It's making our fuel run better, more energy. So, and there's a veterinarian application. We're already working with professional horses and horse racing. It's actually #1 ranked in the world in, I'm sorry, not for horse racing, but the jumping. So the #1 horse in the world is actually using our technology, has a custom-made breathing mask. So there's lots of applications. We're partnering with new doctors and new laboratories and new studies, new pro sports teams. So, you know, when you just do something right out of passion and you want to do something good for the consumer and you put their needs first, I think that's when magical things can happen. And you stay consistent with it and you're not chasing that dollar sign and you're chasing customer satisfaction and results, good things happen. And that's what's happening with us.
Oh, absolutely. Because I think it was about a year ago we met, and the amount you've grown,
Yeah.
and the people that you've met. So I can definitely vouch for Dr. Naisha Winter, and she's a bit like me. She won't just she's very skeptical, but she's very open-minded as well. And for people who've never heard of her, she's excellent person to follow if you've got cancer or worried about somebody with cancer. And she's a really nice lady as well, because I have met her. So no, I agree that the Axiom is really a sort of on the upward trajectory now, and it's just a really exciting field, because I think we've run out of time, but it's also people might be able to hear that there's noise in the background. But what excited me the most about hydrogen was when I got deep into Dan Winter's work, the idea that hydrogen radii is a golden ratio, and when hydrogen assembles, it makes gravity, and then gravity can induce a voltage. That's why I love water vortexes so much. It's something for people who think like me, because I think in biological terms, but now I've moved much towards physics, even though I'm not a physicist and I'm useless at maths. I think when I discovered this other property of hydrogen and the gravity and the voltage in my little tiny brain, that's how I thought, oh yeah, that's how it's the universal provider of energy in the universe. Because people say that, but what does that even mean? If people want to look at it through a biology lens, because you've talked about that a lot, it's definitely true. And then I would say using it as a fuel in a car is a physics, that sort of combustion, and more sort of a physics side. And I suppose with people that love plants, you water your plants with it, don't you?
I do. I absolutely do. And they love it. They love it. And actually I'm using warm hydrogen rich water, and what was previously thought that the colder cool water was better for the plants, actually the warm water is actually a little bit better than the cold water. And I even forgot we have a new countertop hydrogen unit coming out that's using nanotechnology. You can control the temperature of the water, nanotechnology, so we're getting super saturated levels of hydrogen in the water. We actually added a vortex in there because I've done the research of Jared Pollack and specifically Victor Schwalberger. And so he is what I call the Nikola Tesla of water. And so many years ago, I was blown away by his work. And so in this technology, our countertop unit, we actually are not only vortexing the water, we have a filtration using nano filtration and reverse osmosis. We have the vortex, we have nano bubble technology to get us more stability. And these nano bubbles, are the ones that you can see, are actually micro, but they don't float up. They actually sink to the bottom and get smaller and smaller and smaller, and then fully saturate into the water. And so much more stable. Then we're imparting low-level frequencies into the water using the Schumann resonance. And then we use a UVC light for extra sanitization. And then we're using bipolar magnets. So we add bipolar magnets into the water as well. And we just recently invested in a viscosity meter for our little in-house laboratory, and is showing a lower viscosity. So viscosity is measured for people that are unaware, and tension of the water. And the lower the tension, the faster the water flows. And so this new countertop unit will be releasing maybe by the end of the year. We're still in our testing phase, but it is what I could arguably say maybe one of the healthiest waters in the world. And we also remineralize it as well. And so that's just phenomenal. And then that's what I use at a slightly warm temperature to give to the plants. And of course, the animals. We have a bunch of animals here too, and they love that.
Yeah, that's what I was getting at before about any new products that you've got on the market. Because I had, when we talked last year, it was all theory, and I knew you were making something, but I think it's like the ultimate water device. So I think people who are water fanatics, because I definitely am, will be really curious. Where can people find out more about you and your company, and listen to more about you talking about hydrogen, or where can they look?
Sure. So I would say you guys, for those on Instagram and or social media platforms, you can check out Hydrogen Warrior. That's more of my kind of personal account, and as well as, we talk a lot about hydrogen and other health topics. Those that want more specifically just hydrogen and podcasts and webinars, I would check out Axiom H2. That's AXIOM H2. And so you can check Instagram, you can check Facebook, or you can check TikTok. We also have a YouTube channel, Axiom H2. And there too, you can also see the links to our website, axiomh2.com. And so there's more research on there. You can always email us at info@axiomh2.com, where we can provide you set up with a phone call if you want to do a podcast with me, or you just have questions about the technology or our research, or a location maybe nearby you to try something. So please don't hesitate to reach out to us. We are very passionate and pride ourselves in giving you guys the best customer service, because that's what I wanted. And, as a consumer, I want to be treated like gold when I buy a product, and especially expensive product. So we want to offer that same thing to you guys as well.
Okay, that's excellent. So thank you very much for educating us on hydrogen. It's been really nice to talk to you again, and I really hope people love the hydrogen as much as we do.
Yeah. Well, thank you so much, Sarah. Thank you for everyone watching. I really appreciate everyone's time and hearing me explain about my passion. So thank you all, and hope to chat with you soon.
If you're interested in buying Axiom Hydrogen Machine or Axiom Hydrogen Tablets, the link is in the description. And if you use code Dr. Sara for a discount, there's a sale on at Axiom at the moment until May the 14th, 2025. And there are bundles on offer as well. And if you use the same code Dr. Sara to access the discounts in the sale. And also stay tuned for the next video, which will be Tristan Scott talking about bioelectronics and light, and then also Morley part 4, and then my podcast with Dan Winter, which was pretty brain challenging. Thank you for watching.